Hi, my name is Larry Baraducci. I am visiting here in Beverly Hills. I've come to see Dr. Brian Wachler for treatment of my keratoconus. I am 53 years old. I was diagnosed with keratoconus when I was 32 and fitted with gas permeable lenses at the time and told that that was the main treatment for keratoconus, and that possibly at some point in my life I would need a corneal transplant. And for many years I didn't worry about it very much because my visual correction was pretty good and I did well with the gas permeable lenses. But over the last 3 years, as I've gotten older, my visual acuity has worsened somewhat and it's become more difficult to fit me with contact lenses. And I had this creeping fear of moving towards a direction of needing corneal transplantation. I'm a cardiologist. I have 2 young children. The thought of getting corneal transplants and the risks associated with it, as well as the inability to necessarily get good vision with them, kind of had me scared. So I started doing research online to see if there were any alternative treatments for keratoconus, and was led to Dr. Wachler's website and practice. And after reviewing a lot of the information about the procedures that Dr. Wachler has developed and perfected, I made a decision that it was time to come here, be evaluated, and see if there were things that I could do to preserve my vision and hopefully prevent the need as I get older for corneal transplantation. I came here on a Wednesday and visited with the staff in the afternoon. Staff are highly professional. The office is extremely well run, very mellow environment. I had all my pre-procedural testing and then had a consultation with Dr. Wachler, who advised that I would be a good candidate for the Holcomb C3-R procedure to enhance or to strengthen my corneas with collagen cross-linking, and also that I'd be a good candidate for the Intacs procedure, which the insertion of a small partial lens at the margin of my cornea would help flatten out my cone and over time hopefully make my best corrected vision significantly improved. I had those procedures on a Thursday morning. It was all very easy. Recovered Thursday throughout the day, just taking it easy, and I visited with them here on Friday for my post-procedural check, and I'm feeling quite good and quite hopeful about my future in terms of my vision. So part of the reason for making the trip out here is, as I've said, as I've gotten older, the worry about losing vision and the worry about having to have operative procedures to try to restore vision really kind of scared me. I'm going to be working for quite a long period of time with two young daughters, want to see them grow up, want to be able to play with them, and once again, losing vision made me feel quite fragile. So it is for that reason that I did the research and made the decision to come here and meet with the world's expert in keratoconus. I think it's very important as a patient that we try to get the best possible care for the conditions that we have and that we not settle for something less than good. And so I would advise anybody with keratoconus to make a visit out here and to meet with Dr. Brian and his staff and to get an evaluation and to try to protect their vision at all costs.